So lip lift is a very popular procedure these days. And it's something that I actually love performing just from a surgical standpoint. And I actually love the results of the procedure. It's an incredibly effective way of making somebody look, frankly, younger almost immediately. If you can see the person's upper teeth more easily, it makes the person look younger. If you can sort of shorten that upper lip in a way that looks natural and it allows you to see the upper teeth better, it makes them look younger immediately. One of the reasons I like doing it these days is because I think the technique has gotten better. So instead of just removing some skin from underneath the nose and putting the skin edges back together, the technique has developed where we can make it so that once the incision heals, it's virtually impossible to see. A lot of people are concerned that an incision underneath the nose is going to be visible because, frankly, it's right in the middle of your face. But there are things that we do these days to make that so that it's not really visible. The design is very important, and that's all part of the preoperative planning and the discussion with the patient. And then during surgery, after we've removed the skin, it's very important to do what we call undermining. So undermining means that we're actually lifting up the remaining skin, almost like when you're sort of lifting up underneath a carpet, just so you can sort of loosen up those attachments so that when we put the skin edges back together, they're not under tension, they're not pulling apart. And when they're not under tension, that incision is going to heal better. And we do that undermining underneath what's called the SMAS. So it's almost like similar to a deep plane lift or a deep plane neck lift, where we're working underneath that muscle layer and we're releasing those attachments, and then we're putting the muscle layer back together with sutures that are underneath the skin that eventually dissolve, and that takes the tension off of the actual skin edge, and then we put the skin back together with some very, very precisely placed sutures that are removed after surgery. So it's very similar to like if you cut your hand and you go to the emergency room and they put that together and they put sutures underneath the skin to hold the skin together, and those sutures last long enough for your body to form what's called a fibrous union, and that takes the tension off of the skin edges, so when the skin edges are put together, they heal better and they're not going to cause a wide scar. So it's very similar to that, and that's why currently with the lip lift, those incisions underneath the nose are virtually impossible to see, and that's part of the reason why the results are so much better these days.